Welcome to another MU Healthcare Y107 Ask the Expert podcast. And this time around, we have Chief of Hospital Operations, Keri Simon, with us. A big update on the new Children's Hospital at MU Healthcare, less than a year away. Tell us about what's new with the construction.
Thanks for having me. Always excited to talk about it. If you drive over there, you'll see the building is up and the cranes are down, so that's a great sign of progress. We are working now on finishing the inside of the building to be ready for patients and families in June of 24.
I love the term building up, cranes down. Anytime I start seeing stuff on social media of TJ with a hard hat on running around inside that building, that's pretty exciting.
Yep, great sign that we're making good progress.
It's hard to believe that it's coming June, right, of 2024?
Yeah, so we're actually going to start moving patients into the building a few months before that, but we will be completely finished and fully occupied by June of 24.
People may be wondering, why is MU Healthcare building a new children's hospital and birthing facility on the main campus? What's the reason for that?
Yeah, it's a great question and one that we hear very often. The facility over on Keene Street has served patients very well for many years, but it's a wonderful opportunity to be able to build a building from the ground up specifically for those patients and families. It also allows us, by bringing everything back to the central campus, allows us to have all of our specialists in one place and all of the kind of the high-tech things that make it easier and more convenient for patients not having to travel between two different locations. So better for patients and families.
Unbelievable how much just that whole central campus, especially now you put this crown jewel of a children's hospital there now, it's top-notch, one of the best in the country.
Yeah, it's really amazing. There's a lot of exciting things going on over there. We opened the Next Gen facility not too long ago, and this kind of crown jewel, as you put it, will sit sort of right in between that Next Gen facility and the rest of sort of the hospital campus. So really exciting to see the progress on that site.
June next year, June 2024. Get more info. Check it out, muhealth.org/reimagine. So obviously, anytime we start talking about hospitals and newer buildings, if people want to know, what specific is this new building going to provide that's going to be better than what we had before?
Yeah. So in addition to just the advantages of coming from having everything in one place, with the building specifically, I think probably one of the best advantages is that our NICU will be entirely private patient rooms. So today over on Keene Street, we have a 58-bed NICU and only 20 of those are private rooms. And the rest are what we call open pods. In this new building, we'll have a 64-bed NICU and 100% of those will be private patient rooms, which is very exciting for patients and families.
Yeah, especially when you start talking about how scary it is when you have, such a shock, whether it's a premature birth or whatever the situation is, why these little babies, and now you can have the entire family in a room visiting and not sharing with the other family necessarily. And that's just so big.
It's just better on so many different levels. And then, other parts of the hospital as well, very intentionally, a lot of nature infused themes throughout the building, really playing on Missouri landscapes and native animals, lots of natural light, which is better for healing as well as sort of stress levels and sort of mental well-being for both our staff and families. So lots of very exciting things in the new building.
With us again, Chief of Hospital Operations, Keri Simon. Here we say the MU Healthcare Children's Hospital. Well, you can't have children without a mom who's given birth. So let's talk to and about what's going to be new and different for women.
Yeah, so the birthing center is going to be a very great part of this new building. We're going to have more space, which is good. We've seen a lot of growth in volumes, especially some of our high-risk population with our maternal fetal medicine and sort of high-risk specialty. But we also do fantastic work for our low-risk patients. And so having things like low intervention rooms where you want to have kind of a home-like experience with the safety net of a hospital nearby. So we'll have offerings for those families. We offer things called a gentle C-section. So when you have to have a C-section, it's not kind of the sterile OR stark environment that sort of takes away from that experience of giving birth. So there's a lot of very intentional things that we do for all ends of the spectrum.
I know MU Healthcare worked really hard to ensure that this new children's hospital is going to offer convenient and, of course, welcoming environment. Any hospital, you want to have a welcoming environment, and it sounds like you guys are touching on all the boxes.
Yeah, working really hard on that, right? People don't want to be at a hospital. And so for sure, especially with pediatric patients within a children's hospital, we want to make sure when they're there that it is as stress-free and normal feeling for both the child and the family as possible. And so lots of very intentional design elements. When you walk in, we'll have a dedicated entrance, circle drop-off, and lobby area for the children's hospital. And so when you are there, you will know that you are in the children's hospital. Our mascot, TJ, will be ever present to welcome the kids, and lots of color, very fun elements, but also very thoughtful about making sure that they're interactive and that they are designed for those with disabilities to be able to participate in, et cetera.
Yeah, it's absolutely beautiful, the pictures and videos, and there's been some brand new ones just put up here recently. If you have not seen them yet, I highly encourage you, and we'll get a link up on our website, y107.com. Go to muhealth.org/reimagine. Keri Simon, thank you so much.
Thank you for having me.